Welcome to Wound Care 101. In this video, we'll cover the essentials of wound dressing and debridement. Understanding proper wound care is vital for effective healing. Whether you're a healthcare professional, medical student, or caregiver, this tutorial is designed to provide the techniques you need. Throughout this series, we'll explore the basics of wound dressing and the importance of debridement. Together, we'll ensure you have the knowledge to apply proper wound care and prevent complications. You'll see how each step builds on the last. Now, let's dive into the hands-on process of dressing a wound. First, gather all necessary supplies: gloves, sterile gauze, saline solution, and adhesive tape. Put on your gloves to maintain a sterile environment. Using the saline solution, carefully clean the wound to remove any debris or contaminants. Be gentle but thorough to ensure the area is properly sanitized. Next, take the sterile gauze and place it directly over the wound site. Ensure the entire area is covered to protect it from further contamination. The gauze acts as a barrier against infection and helps soak up any exudate. Once the gauze is in place, secure it with adhesive tape. Wrap it snugly, but not too tight, as restricting blood flow could impede the healing process. Make sure the gauze stays in place but is also comfortable for the patient. This step-by-step process is crucial in promoting effective wound healing and preventing complications. Proper technique will improve outcomes and provide comfort and protection for the patient. Next, you'll see more advanced techniques and additional tips to further enhance your wound care skills. Stay tuned for a detailed look into the art of debridement. Debridement is essential in wound care, involving the removal of dead or infected tissue to promote healing. There are several types of debridement: autolytic, enzymatic, and surgical. Autolytic debridement uses the body's own enzymes and moisture to rehydrate, soften, and liquefy hard eschar and slough. Enzymatic debridement involves applying a topical debriding agent to the wound. Surgical debridement is a more invasive method, typically reserved for severe cases where other methods are ineffective. Before proceeding with debridement, always assess the wound thoroughly and consult with a healthcare professional. Determine the appropriate type and timing of debridement. Follow all recommended practices to prevent infection and safeguard the patient's health. Next, you'll see practical demonstrations of these techniques in real time. Common mistakes in wound care include contamination, improper dressing application, and neglecting to monitor the wound. Always use sterile supplies, ensure the dressing is secure but not too tight, and regularly check the wound for infection or healing progress. You'll see how to avoid these pitfalls and ensure optimal wound care. To recap, proper wound care involves thorough cleaning, correct dressing application, and safe debridement techniques. Practice these steps regularly to ensure proficiency. For more information, refer to additional resources provided in the description.